when the nucleus stops rotating. The golden hour of decision making. In cataract surgery, surgeon relies on certain indirect visual clues for identifying underlying complications. Early identification and timely management is very crucial. Such cases with obvious findings can be easily diagnosed preoperatively, but that's not the case always. Like this case, where the underlying zonular dehiscence showed up only after viscodilation intraoperatively. These can be challenging and test the surgeon's agility during surgery. Anticipation is the first step. In cases of trauma, hard ground cataract, pseudoexfoliation, Marfan syndrome, homocystinuria, etc., we should be cautious about a hidden enemy. There could be certain subtle signs of a zonular compromise that can be picked up early in surgery, like dimpling of the anterior lens capsule during rex's initiation, difficulty in raising the flap of the anterior lens capsule, and further, while proceeding with the rexes, wrinkling of the anterior lens capsule can be noticed. At times, these signs could be too subtle to be picked up. So what if we miss them? Do we get a second chance? Yes. Our video points towards those indirect clues which could save the surgeon from having a detrimental complication. Look out for these signs. 1. A sudden fluctuation in the anterior chamber depth. 2. When the nucleus stops rotating. In this first case of a small pupil with dense pseudoexfoliation, after his first job, the surgeon notices a sudden fluctuation in the anterior chamber depth. At this critical moment of decision making, the golden hour, he promptly decides to place capsule hooks. He makes 4 paracentesis and places the capsule hooks to stabilize the bag. He also injects a CTR for further supporting the bag. He continues the surgery, does the chop and the phacoemulsification easily. Now that the capsule hooks and the CTR are holding the bag firmly, he comfortably does the cortex aspiration, carefully and gently. He implants a foldable IOL into the bag. The second case of a hard brown cataract with pseudoexfoliation started off like any other normal case. Surgeon does a well-centered, continuous curvilinear capsular rexus and proceeds with the surgery. During his initial few chops, the nucleus can be seen rotating freely in the bag. But later on, he notices that the nucleus stops rotating. This alerts the surgeon. Yes, yet another golden hour. He reassesses the situation and decides on placing capsule hooks. After placing the capsule hooks, the nucleus rotates freely and the rest of the surgery is completed effortlessly. What could have been a larger zonular dialysis was prevented by the surgeon's early identification and timely management. In this last case again of a hard brown cataract, we can see that the nucleus was freely rotating in the beginning of the surgery. But as the surgeon proceeds with the surgery, the nucleus stops rotating. The surgeon gets alerted. Another golden hour. He stops and reassess the situation. He identifies the presence of a PCR. He promptly converts the case to a small incision cataract surgery and completes the case successfully. Due to the surgeon's vigilance during surgery and promptness in decision making, he prevents a larger complication. Finally, the take-home message of our video. When dealing with complicated cases, 1. Anticipate a hidden enemy. 2. Be vigilant during surgery. 3. Early identification of any complication. 4. Reassessment of the situation. And 5. Prompt decision making. Concluding with the proverb, a stitch in time definitely saves 9. Thank you.